Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. So far we have posted many videos related, that is PPTs related to the nursing subject. Today we are going to see about the competitive exams questions with the rationale for nursing officer preparation. So those who all the students who are going to prepare for your central government examinations or any state government examinations like NORCET, JIPMER, RRB or MNS examinations, this video will be very useful. So kindly don't skip the video and see completely. If you have any doubt, kindly drop down in the comment box. So today we'll be seeing about only the 5 questions. This questions is being taken from the NCLEX RN. So this will be mainly focusing on the reasoning questions and theoretical, how we are going to use the scientific principles and how we can prepare for our nursing officer examinations. So in just of 10 minutes we will see only the 5 questions related to the nursing officer examination. So first question is, a neonatal nurse assesses a premature newborn baby using Apgar score. All of the following assessment are given score except. So in the question it is given except. So option A grimace, option B pulse, option C activity, option D routing and option E appearance. So according to Apgar score, whether it is a premature baby or term baby, whatever it is, the Apgar score consists of A for appearance, P for pulse, G for grimace. Grimace is nothing but a reflex, and A for activity and R for respiration. So among these 5, routing is not related to the Apgar score. So what will be the answer is, among these 5, that is grimace, pulse, activity, routing and appearance, the answer will be routing. So why? Because in Apgar score the routing is not included. So we will only assess the appearance of the baby, pulse of the baby, grimace of the baby, activity of the baby and the respiration of the baby. So you must know what is meant by Apgar score. I have already added a video related to essential newborn care. In that I have explained about the Apgar score. So about when the baby is born, within 1 and 5 minutes we will be assessing the Apgar score. That is between the 10 score, up to 10 score there will be. So we will, based on the baby's physiological conditions, we will that is physiological adaptation to the extrauterine life, we will give the score, and based on that the care will be given. So this is the first question. So we have to be very careful. In this question they have given except, that means not related to the Apgar score, what is there, that is they have asked. So that is only we have to see it very carefully. So next question is, a child with a history of seizures begin to seize suddenly in his hospital room. The nurse would do all the following interventions except. So among these 4 options, what the nurse will not do, that only they have asked clearly. So first option is, loosen the child's clothing and remove the pillow from his bed first. B, administer lorazepam rectally. Next, C, roll the child on his side. And D, restrain the child arms and legs. So you itself think, if a baby is having seizure suddenly, as a nurse, what intervention we will not do it? So the answer is, we will not restrain the child arms and legs. So first option you see, we will loosen the child's clothing and remove the pillow from his bed. Yes, of course, we will loosen all the child's clothing and remove the pillow from the head and side. And the same way, we will administer the lorazepam rectally. So orally we will not give, because there will be secretions from the baby's mouth. So we will, for the better action, we will administer the lorazepam, that is, it is anti-seizure medications, we will administer rectally. Next, roll the child on the side. Yes, of course, we will roll the child on the side. Why? Because to obtain the to prevent the backflow of the tongue, as well as to remove the secretions from the mouth. So D, restrain the child arms and legs. As a nurse, we will not restrain the child's arms and legs. Why? Because no, during the seizure time, if we are restraining the child's arms and legs, it may lead to the musculoskeletal injury. So among these 4 options, what nursing action we will not do when a baby is having seizure is option D, we will not restrain the child. So next question is a 32-year-old woman comes into the clinic for a well woman exam and asks for information on an intrauterine device for contraception. The nurse should explain that all the following are potential risks except. So that means here also the word has given except. So more or less in the among these 5 questions I have only given the except questions. So first option is stroke. Second option pelvic infection. C, abnormal menstrual bleeding, and D, ectopic pregnancy. So first we must know what are the potential risk of intrauterine device. Among these, if a woman is asking about the intrauterine device potential risk, so pelvic infection, it is a risk of IUD. Abnormal menstrual bleeding, yes, of course, it is a potential risk for IUD. Ectopic pregnancy is also there. So, but whereas stroke, it is not associated with the potential risk for intrauterine device. So, it is associated with the oral contraceptives only. Okay. So, as a nurse, when a woman is coming and asking to the medical professionals regarding the intrauterine device potential risk, we will not tell about the other potential risk related to other contraceptives, other temporary contraceptives. So among these 4 options, the stroke is the right answer. So about stroke, we will not explain to the woman. Okay. So next, 4th question. All of the following are risk factors of sudden infant death syndrome, SIDS, except. Okay. Option A, low birth weight. Option B, placing the child on his back. Option C, young maternal age, and option D, maternal smoking during pregnancy. So here again we have to understand the question. So here they have asked that among these 4 options, the risk factors of sudden infant death syndrome is given. So among this, one is not the risk factor of sudden infant death syndrome. So first one, low birth weight, yes, of course, it is one of the risk factors for sudden infant death syndrome. Option C, young maternal age, yes, of course. Next, maternal smoking during pregnancy is also one of the risk factors of sudden infant death syndrome. But whereas the option B, placing the child on his back, it is not a risk factors of sudden infant death syndrome. Why? Because no, according to American Academy of Pediatrics, what they have mentioned is we have to place the baby on the prone position, in the back only. So when we are placing the baby on the side of abdomen or side lying, it will cause the risk factors of sudden infant death syndrome. So we have to place the baby only on the back. That is, as a supine position, we have to place the baby to sleep. Next, last question. A nurse receives an order to dilute ceftriaxone sodium powder in a vial prior to administration. The nurse should ensure the powder is fully diluted by 4 options are given. So first we will understand the question. So as a nurse, we have been received an order to dilute the ceftriaxone sodium powder. It is in a vial form. So what are the steps we will follow in diluting? First one, shaking the vial at least 60 seconds. Second option, rolling the vial between the palms of hands. Option C, allowing vial to sit for at least 10 minutes before administering. And option D, asking the pharmacy to dilute the mixture. So among these, we will only do the rolling, option B, rolling the vial between the palms of hands. So first one we will see, shaking the vial at least 60 seconds. If you are shaking for 60 seconds, what happens? It may lead to the breakage of the vial. So option C, allowing vial to sit for at least 10 minutes before administering. So it is nowhere going to help you in dilution of the powder. Okay, so it will only cause the sedimentation of the powder. Next is asking the pharmacy to dilute the mixture. So nowhere the nursing officer will go and ask any pharmaceutical person to dilute the vial, the mixture. So we as nurses, we only do the that is loading of medications or administer of medication. So the correct option is rolling the vial between the palms of hands. So what happens during the rolling of vial between the palms of hands? It produces the heat. That heat will aid in the dissolution of the powder. So this is only going to help in dissolution of the powder that is present in the vial form. So this is some of the practical questions I have been taken from the NCLEX RN book. So this is the most repeated questions in many of the central government examinations. So far we have discussed about the 5 questions related to the reasoning questions or using any scientific principles in answering the questions. So if you wanted this session to be continued, kindly drop down in the comment box that if you want, I can also add some more questions, like 10 questions in a day. So the self-assessment questions can be done, so that it will be easy for you to prepare for your examinations in very comfortable manner. So if you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it, and thank you for watching the video. If you have any doubt, kindly drop down in the comment box. Then thank you for watching.